Welcome to CPR and AED training, conducted by Provider Agency Training Center. In this video, we will provide you with a step-by-step guide on how to perform CPR and use an AED properly. We will cover the basic concepts of CPR such as chest compressions and rescue breathing, as well as the proper technique for using an AED. What is CPR and AEDs? CPR is a life-saving technique that involves compressions to the chest and rescue breaths to circulate oxygen and blood to vital organs. This technique is used for people whose heart has suddenly and unexpectedly stopped beating or became abnormal. An AED is a portable medical device to restore a person's normal heart rhythm. It uses an electrical shock administered through electrodes placed on the person's chest to bring the heart back to a normal rhythm. There is a few steps that you need to take before administering CPR. First, assess the situation to ensure that it is safe to approach the person. Check for any potential hazards that could cause harm. Next, check for responsiveness. Attempt to awaken the person by tapping or shaking the shoulder, and calling out to them loudly. Call for help. If you have someone with you, have them go and retrieve the first aid kit and call emergency services, and let them know if you have an AED on hand. Time is of the essence in a cardiac emergency, and it is crucial to get help as soon as possible. When you come across someone who is unconscious or unresponsive, the first thing you need to do is check to see if they're breathing. Check for breathing by tilting the head back gently and lift the chin with one hand, while putting your ear near the mouth and nose to check for breathing, listening and feeling no more than 10 seconds. If the person isn't breathing or is only gasping for air, begin CPR immediately. Now, let's talk about CPR positioning. When performing CPR, it's important to make sure the person is lying on a flat and stable surface. This will provide a solid foundation for administering compressions and help ensure the person remains in a safe, secure position throughout the process. Begin by tilting the person's head back slightly to open their airway. Then use your hands to lift the chin and support the jawbone. This will help prevent the tongue from blocking the airway. Next, position your hands on the person's chest, with your fingers interlaced and the heel of one hand placed upon the other. Make sure that your elbows are locked and your shoulders are directly above the hands. Now that we have them in position, begin chest compressions. Begin giving compressions by pressing down on the center of the chest at least 2 inches deep, with a rate of 100 to 120 compressions per minute, and allowing for full recoil after each compression. Recoil is just as important as compressions because it allows blood to flow back into the heart. Remember to maintain a consistent rhythm and depth of compressions until professional help arrives or the person starts showing signs of life. It can be tiring, but try and switch out with someone else, if possible, to avoid fatigue. After compressions, begin rescue breaths. To perform rescue breathing, start by tilting the person's head back and lifting their chin to open their airway. Pinch the person's nose closed with your thumb and forefinger and take a deep breath. Place your mouth over the person's mouth, forming a tight seal, and blow into their mouth for about 1 second until you see their chest rise. Repeat this process twice, giving 2 rescue breaths. It's important to monitor the person's chest for a rise and fall, as well as for any signs of breathing or movement. If the person begins to breathe on their own, stop rescue breathing. When someone's heart has stopped beating, an AED will help restore a normal heartbeat by delivering an electric shock to the heart. An AED is simple to use, and anyone can learn how to use it. First, turn on the AED and follow the instructions provided by the device. Many AEDs have voice prompts that will guide you through the process. Follow these prompts carefully and do not deviate from them. Next, remove the person's clothing to expose their chest and locate the 2 pads on the AED. Place the one pad on the upper right side of the person's chest and the other pad on the lower left side. Once the pads are in place, the AED will analyze the person's heart rhythm. Stand clear of the person and let the AED do its work. If the AED determines that the shock is necessary, it will deliver a shock through the pads. Make sure that no one is touching the person or any conductive surfaces when the shock is delivered. After the shock is delivered, immediately begin CPR. Follow the standard CPR protocol of 30 chest compressions followed by 2 rescue breaths. Continue to use the AED and perform the CPR until emergency services arrive on scene. Now that we have covered all the individual steps of CPR and AED, let's review them quickly in the order they should be performed. Step 1. Assess the situation to ensure that it's safe to approach the person. Check for any potential hazards that could cause harm. Step 2. Check the person's responsiveness by tapping their shoulders and asking if they're okay. Step 3. Call for help or ask someone else to do so. Step 4. Check for breathing for no more than 10 seconds. Step 5. Position the person and yourself for compressions. Step 6. Position your hands in the center of the person's chest. Step 7. Begin compressions by pushing down on the person's chest. Step 8. Give rescue breaths by tilting the person's head back and breathing into their mouth. Step 9. Utilize an AED by following the prompts and attaching the pads to the person's chest. And that's it! Remember to always call for help and check for breathing before starting compressions. Don't forget to utilize an AED if one is available. In addition to CPR and AED techniques, we will also cover the relief of choking. Choking can occur when a foreign object blocks the airway, and it's important to act quickly to prevent the person from suffocating. The first step in helping a choking person is to assess the situation. Determine if the person is able to cough, breathe, or speak. If they can't, they may be choking. The next step is to call for help immediately. Shout for someone to call 911 or emergency services. If the person is conscious, we will perform the Heimlich maneuver. If the person is unconscious, begin CPR immediately. Remember to act quickly and calmly. Now let's cover how to perform the Heimlich maneuver. Stand behind the person and wrap your arms around their waist. Make a fist with one hand and place it above the person's belly button. Grasp your fist with your other hand and give a quick upward thrust towards the person's abdomen. Repeat until the object is dislodged or the person loses consciousness. Before we conclude this CPR and AED training, it's important to cover some legal considerations that are associated with administering these life-saving techniques. First, there's a duty of care that you owe to the person in need. This means that you have an obligation to provide reasonable and necessary assistance to someone who is in a life-threatening situation. Second, you must obtain consent from the person before providing aid. If the person is unconscious and unable to give consent, the law typically assumes they would have consented. Third, negligence can be a concern if you fail to provide appropriate care. This can result in legal liability and potential lawsuits. Finally, there are Good Samaritan laws in most states that protect people who provide reasonable care in an emergency situation from legal liability. These laws encourage people to provide assistance in an emergency without fear of being sued. These are just a few considerations to keep in mind when administering CPR. It's important to always act in good faith and with the best interest of the person in need. Thank you for completing this CPR and AED training conducted by the Provider Agency Training Center. Remember, you have the knowledge and skills to save a life.